May I ask, how many times have you increased your salaries? Yes, please let me finish, Madam Chair. Kung ganito ang mangyayari, abutin na naman ako ng alas 11 mamayang gabi. Kung ano yung point of order and when it is going to be raised. Di ba? Kasi ina-allow nyo eh. Yun po ang rules natin. Dapat yun ang sundin natin.
I really don't want to make a point of order, but I would find it unfair on the part of the administration being wrongly accused na maraming mga programa sa kalusugan ang tinapyasan. Mr. Chair, the figures is not correct.
Madam Chair, point of order.
Madam Chair, I'm having a point of order.
Po, hindi po siya isang point of order. Order is about yung proceedings natin, yung paano natin
Madam Chair, hindi po totoo
that is an
yan.
interjection kasi facts po yung pinapresent, Madam Chair.
Yeah, Madam Chair, you can make a point of order if the figures being presented is not correct. Because this is a budget briefing. Hindi po pwede na meron tayong drama na pinapalabas natin na lahat ng programa ng kalusugan ay tinapyasan and making the administration look back where in fact it is not true. We have to compare net versus net. So with that, Madam Chair, I move that the interpellation of the Honorable Manuel be stricken off the records. So move, Madam Chair.
1 minute suspension.
I raise it as a point of order kasi tila pinapalabas na tinapyasan lahat ng programa ng kalusugan, and that's very unfair to an administration who has been investing on health. Kung magdadagdag tayo ng pondo, dagdagan. That's why my point of order is that there was a misrepresentation of the facts given because comparison is net versus net. Kaya yung mga sagot kanina na tinapyasan lahat ng programa ng kalusugan, that is not factual. I therefore move earlier, Madam Speaker, that those statements be stricken off the record. Because that will make the administration look bad. And that will make us look bad na parang lahat ng programa sa kalusugan ay tinapyasan natin. That's unfair to the people who have been working for the budget of the Department of Health.
Kasi kanina pa akong umaga rito Madam Chair. Kung ganito ang mangyayari, abutin na naman ako ng alas 11 mamayang gabi. Just like the DOTR. Now, let's settle the issue. Bakit nyo pinapayagan yung point of order?
We will be clarifying the rules.
Please let me finish, Madam Chair. Because our rules state specifically kung ano yung point of order and when it is going to be raised. Di ba? Kasi ina-allow nyo eh. But if I read section 103 of our House Rules, and I would like to quote, a point of order is a privileged question that raises a violation of the rules in relation to the matter under discussion on the floor. A motion to read any part of the rules is equivalent to a point of order and takes precedence over any other motion other than a motion to adjourn. Yun po ang rules natin. Dapat yun ang sundin natin. May I know from the Department of Health, how does the DOH arrive at the allocations provided for each region? And what are the factors that were taken into consideration in determining these amounts? I asked this question, Mr. Secretary, kasi yung Region 4A, insofar as the regional allocation of the 2024 expenditure program is concerned, 2.98 billion lang ang nakukuha ng Region 4. In the other departments, nasa top 5 palagi ang Region 4A. May I know the reason why ganito na lang ang napunta sa Region 4A?
Madam Chair, Your Honor, we usually assess the receiving LGU whether they can fulfill the requirements, if the site is available, if the readiness of the place to build the health facility, if they are willing to commit with the healthcare workers after the facility is finished, and then there's also based on criteria on the poorest. We usually allocate the poorest and most needy localities first and then prioritize over.
In the previous years, Mr. Secretary, ano po yung position ng Region 4A?
According to my colleagues here, Madam Chair, Your Honor, is in the top 3 for the funding support. Region 4A gets a lot of support, I guess, based on the population.
That is precisely the question that I'm asking, Mr. Secretary. Bakit in the previous years, nasa top 5 siya, ngayon bigla siyang bumagsak? May I know the reasons why?
I will look into that, Your Honor. So we'll investigate and we'll submit to your office why it went down.
May I go to the PhilHealth Insurance Corporation, what was your surplus in the year 2022?
Magandang hapon po sa ating lahat. As to the surplus in the year 2022, we have 76.64 billion, Mr. Chair, as we have premium contribution of 207.2 billion and benefit payment of 130.56 billion, Mr. Chair.
As what was your total assets in 2022?
Of our total assets, year 2022 amounting to 454.8 billion pesos, Madam Chair. 454.8 billion, Madam Chair.
Tatanungin ko po kayo, sa inyong laking pera na kinikita, kailangan nyo pa ba ang subsidy from national government? Kasi ang gobyerno po natin, nahihirapan na nga na humahanap ng pondo eh. So, I am asking that question. Kailangan nyo po ba ang subsidy from national government when in fact, according to the statistics, kaya nyong mag-self-sustain eh?
Sir, we need the subsidy because we are currently in the process of expanding our benefit packages, which we haven't done, which PhilHealth has not done po in the last 10 years. And
With your indulgence, in the last 10 years, hindi pa nyo na bago yung inyong benefit package. May I ask, how many times have you increased your salaries?
if I can allow, Madam Chair, if I can allow our COO to answer the question.
Sir Santos?
Madam Chairperson, Honorable Representative Acop, I do not have the exact data right now, but I can say that before 2021, November 2021, we implemented the CPCS based on the Executive Order 150 issued by the Office of the President, and this is based on the study conducted by the GCG.
Madam Chair, tinatanong ko lang po kung ilang beses na tumaas yung kanilang sweldo for the past 10 years. Kasi 10 years, sabi nila,
Please.
hindi nababago yung benefits na binibigay eh. So, I would like to ask, in the past 10 years, ilang beses na tumaas ang mga sweldo nila?
Only once, Madam Chairperson, this 2021. Actually, Madam Chairperson, Honorable Representative Acop, we were really behind because before this implementation of EO 150, we were still under the SL salary SL4. However, the national government was already in SL5, Madam Chairperson, Honorable Representative Acop. But we will provide the required data.
I will go to one issue insofar as the services of PhilHealth is concerned. With regards to the health packages the PhilHealth provide for admitted patients, what would be the average percentage that these packages cover on the total hospital bill?
10,000 pesos per claim. But as to how much per case rate, Madam Chairperson, we do not have at present the necessary data.
I will cite an example. In the case of pneumonia, PhilHealth charges different amounts based on the classification of the hospitals. Di po ba? Pag class A or B, 15,000 yung inyo pong sinisingil. And for lower class classification of hospitals, 10,000. Tama. And if you look at it, it requires the same management and it requires the same medicine. Now, bakit po ganun ang pagsingil po ninyo? Bakit may difference na 5,000? It depende sa klase ng hospital.
We don't pay po our packages differently sa types of hospital. So kung ito po level 1 or level 2, level 3, yung pong pneumonia, ang difference ng pagbabayad natin is according to the disease. So the disease po type. Kung ikaw ay yung moderate type of pneumonia at ang package po natin, for example, in a moderate type of pneumonia is 15,000, yan po ay ibabayad natin kung ikaw man ay na-admit sa level 1, level 2, or level 3. Hindi po nag-iiba-iba ang package rates natin according to the levels of facilities.
There was a time when PhilHealth required that pneumonia cases be admitted for 96 hours. Di po ba? So, depende sa number of hours. Kasi, kung yung pasyente i-discharge mo before 96 hours, merong return to hospital yung claim nila.
The general rule po is...
Hindi, sagutin mo muna ako. Hindi ko tinatanong kung ano yung general rule. Tama po ba yung sinasabi ko?
Wala po tayong on the number of hours except for the 24 hours po yung general rule for admission. Ngayon, kung pneumonia po kayo, kung ito man po ay na-admit kayo ng 3 days or 4 days, again, ang package rate po natin is dependent kung anong type ng klase ng pneumonia, kung moderate or severe type of pneumonia.
Okay.
May I also remind everyone to please address the chair? Thank you.
Sorry, Madam Chair.
PhilHealth coverage as a percentage of the population for 2022 is 70%. Would that be correct? Madam Chair, magsi-second round na lang ako. And I'll just ask PhilHealth to prepare for the second round dahil marami pong issues dito. Para dun sa aking mga kasamaan, pwede na silang magtanong. Thank you, Madam.